both can potentially harm your kidneys. But what's the right amount of water to drink? Many people believe in the old adage that you should drink 8 cups, or about 2 liters, of water daily to stay hydrated. This is actually a myth because people tend to confuse water intake with fluid intake. Water intake is simply drinking water, but fluid intake includes all drinks and foods containing water. When we talk about keeping yourself hydrated, it's about everything you consume, not just plain water. That's why the advice to drink 2 liters of water daily is not exactly correct for everyone. In this video, we will give you tips on monitoring your water intake for the best kidney health. From when to drink water, to how much to drink, and the safety levels of different types of water. Note that in some cases, drinking only plain water may not be enough. Next, we will explain in detail how drinking too much or too little water can damage your kidneys. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. While experts are still determining the proper amount of water needed daily, drinking more than 1 liter or about 1 quart every hour will cause extra stress on the kidneys. According to the Merck Manual, one estimate suggests that repeatedly drinking more than 23 liters or 24 quarts of water over 24 hours may cause excessively high water levels in a young adult with normal body function. Rest assured, your kidneys usually filter out excess water, so water toxicity, overhydration, water intoxication, or drinking too much water occurs rarely in healthy people. People at risk for overhydration are endurance athletes, premature babies, and people with certain mental illnesses and pituitary disorders. Water intoxication may also occur in those with kidney, liver, and heart disease due to their impaired abilities to maintain proper fluid balance. People taking on drinking challenges and those who have consumed large amounts of alcohol may also be subject to water toxicity. Certain medications such as diuretics, antidepressants, antipsychotics, and drugs such as MDMA or ecstasy may cause people to consume excessive amounts of water as well. Drinking too much water too quickly dilutes the sodium level in the blood. Healthy sodium levels are between 135 and 145 milliequivalents per liter. When sodium levels are under 135 milliequivalents per liter, this is known as hyponatremia. Healthy kidneys can remove excess water at a rate of about 1 liter or 1 quart per hour. Water intoxication occurs when the kidneys can't remove water fast enough to maintain the normal sodium balance. Water will then move into the cells, which contain more sodium, causing fluid retention. The fluid retained in cells causes them to swell or become too big. This state, a main concern of water intoxication, may even cause swelling in brain cells, known as cerebral edema. Symptoms of water intoxication may include trouble thinking clearly, nausea, and vomiting. Early treatment is essential, as severe cases may cause seizures or death. During the 2002 Boston Marathon, almost 500 runners enrolled in a study investigating race-related causes of hyponatremia. After finishing the race, over 60 marathoners experienced low blood sodium levels related to overhydration. To reduce the risks of hyponatremia, the researchers recommended that long-distance runners estimate their water needs during a marathon. They should weigh themselves before and after training runs and hydrate, according to how much fluid they've lost through sweating and how thirsty they feel. Another study, published online in 2021 with BMJ Open, surveyed 590 patient reports. The study included patients with hyponatremia resulting from water toxicity. On average, the patients drank 8 liters of fluids daily. Severe effects included seizures and coma, while other symptoms reported were vomiting, lightheadedness, and weakness. Unfortunately, a small number of patients experienced brain damage due to complications, while over 75 of the patients died. Overall, drinking too much water, although not common, may cause low sodium levels in the blood and fluid retention. These problems can cause severe damage to the kidneys. Studies also highlight the dangers associated with overhydration that may lead to death. Next, learn how kidney damage can also occur from drinking too little water. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. Drinking too little water to stay hydrated. You should know when you need more water. Under normal circumstances, water loss occurs when we sweat, breathe, defecate, and urinate. For instance, during physical exercise, you breathe faster and sweat more. Pregnant or nursing women have additional water requirements. Also, water needs may increase if you're in hot weather or high altitudes. When you are ill, you may lose significant amounts of water with a fever, vomiting, or diarrhea. Dehydration occurs when water is lost faster than it can be replaced. Due to the abundance of water in most places, people can easily avoid becoming dehydrated. However, many adults, particularly older adults, are chronically dehydrated. Some older individuals have weakness, decreased thirst sensation, diabetes, or kidney damage that may put them at risk. The risk of dehydration also increases if you drink too much water without enough electrolytes. Still, we'll discuss this later. When the body is dehydrated, it attempts to correct the fluid imbalance through several mechanisms. Special sensors in the brain, known as osmoreceptors, detect changes in the blood's fluid and electrolyte balance. The hypothalamus signals the pituitary gland to release antidiuretic hormone, or ADH for short. ADH tells the kidneys to stop releasing fluid into the urine and instead reabsorb it into the blood. The kidneys also have a mechanism to compensate for dehydration. When the blood pressure drops, they release the hormone renin, which activates another system that increases blood pressure. Renin turns another hormone, angiotensin I, into angiotensin II. Angiotensin II signals the adrenal glands on the top of the kidneys to release aldosterone. Then, aldosterone signals the kidneys to reabsorb more sodium and water. This brings the blood pressure back into balance, while also helping you become hydrated. Dehydration should be addressed to avoid long-term kidney damage, even in mild cases. If dehydration continues and becomes severe, the kidneys will develop acute kidney injury, or AKI for short, which can occur in as little as 2 days. Low fluid volume also increases the risk of urinary tract infections and kidney stones. Even waste products may build up in the filtration system or return to the blood unfiltered. Fortunately, the hypothalamus also signals when you need to drink water. In response to low blood volume, the brain triggers thirst, and interestingly, detects when you swallow fluids. However, by the time you become thirsty, you may already be mildly dehydrated. So, it's best to sip water throughout the day and drink more when you are thirsty. Older adults or those with brain injuries may have a reduced ability to sense thirst and should make sure to maintain adequate fluid intake. A large 2021 study published in Clinical and Experimental Nephrology examined the water consumption of over 50,000 Koreans. The results showed that increasing water intake was important for preventing kidney damage, especially in older men. As the participants drank more water in proportion to their body weight, their kidney function improved. In another 2016 study published in the American Journal of Physiology, researchers highlighted dehydration as a serious concern among field workers. This population has increased rates of chronic kidney disease. The study's findings suggested that thousands of field workers may be related to chronic dehydration. Researchers looked at various types of fluid intake in dehydrated rats to determine the effects on kidney damage prevention. They concluded that the rats who drank soda had the lowest hydration and the worst kidney damage. Rats drinking water or water sweetened with a natural sugar substitute only suffered mild effects of dehydration. So, it's important to stay hydrated by drinking water, not soda. This section discussed water loss and dehydration. Kidney injury, kidney stones, and urinary tract infections may result from inadequate fluid intake. Next, we'll highlight ways to monitor your personal needs for fluid balance. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. Monitor your water intake for kidney health. As mentioned, it's essential to pay attention to your thirst. Urine color, odor, and frequency may indicate how well fluid is balanced. Clear urine usually suggests that you are hydrated enough or too hydrated. When you drink more, you urinate more frequently. When you are dehydrated, your urine turns yellow or amber and may have a strong smell. As the urine becomes more concentrated, you'll also make fewer trips to the bathroom. In this case, you should increase your water intake. However, other factors, such as infections and kidney disease, may also cause changes in urine characteristics. When you are not hydrated, you may wonder if you should have an electrolyte drink. The answer is yes and no. First, let's discuss what electrolytes are, why they are important for healthy body functioning, and situations when the body may experience electrolyte imbalance. Electrolytes are tiny particles that carry an electrical charge. They help the body perform vital functions, including nutrient and waste transport, fluid balance, muscle contraction, and nerve conduction. They also help maintain your acid-base balance, heart rate, and heart rhythm. You've probably already heard the names of the most common electrolytes: sodium, potassium, chloride, calcium, magnesium, phosphate, and bicarbonate. Like water, they leave the body naturally through urine, feces, and sweat. You may lose more electrolytes along with fluid during illness with fevers, vomiting, or diarrhea. Electrolytes can also be lost when you're sweating heavily due to exercise or hot and humid outdoor temperatures, and also when you're taking certain medications. High blood sugar in people with diabetes also causes both electrolyte and fluid loss. Now, when you become dehydrated in these situations, electrolyte replacement drinks are helpful for replenishing fluid and electrolytes quickly. Some people may want to drink them after mild or moderate exercise, but water will usually be sufficient. However, these drinks may still be beneficial after exercising for over an hour with intense sweating or under an hour with vigorous exercise and high temperatures. Electrolyte drinks aren't generally needed throughout the day and may be harmful in some instances. They contain high amounts of sodium, potassium, magnesium, and chloride. For people with kidney or heart conditions, these drinks may increase blood pressure or dangerously raise blood electrolyte levels. Some electrolyte drinks have high amounts of sugar, which can contribute to diabetes, obesity, and other health problems. They may also be full of unhealthy food dyes, preservatives, and artificial sugar substitutes. So, it's best to drink water. If you must drink these electrolyte drinks, read the ingredients label carefully. Most foods also contain electrolytes, but whole food sources from plants are the most nutritious. Good choices would be fruits, such as citrus and coconut water, but also some leafy green vegetables, honey, ginger, brine from fermented foods, beans, seaweed, pumpkin seeds, and fatty fish. These are all excellent examples of nutrient-dense electrolyte food sources. If you've watched the entire video so far, you will be able to recognize common myths about staying hydrated. Myth number 1. You must drink 8 glasses of water daily. Myth number 2. The more water you drink, the better it is for your body. Myth number 3. Drinking water is the only way to stay hydrated. Myth number 4. You should always drink high amounts of electrolytes or sports drinks when exercising. Another myth is that caffeine and alcohol are dehydrating. While both are diuretics that increase urination frequency and volume, moderate consumption can still help maintain your hydration. However, limit caffeine and alcohol along with other sweet drinks since they can have damaging effects on the kidneys when consumed excessively. Up to 400 milligrams of caffeine a day, or about 4 9-ounce cups of coffee, is considered safe. Some people with kidney disease need to be cautious about the amount of water they drink. As kidney damage worsens, doctors may prescribe a limited fluid intake, particularly for those on kidney dialysis. At this stage, the kidney's capacity to create urine and regulate the amount of fluid in the body is greatly reduced. Some people may even stop making urine. However, people with kidney stones or urinary tract infections, or UTIs, should increase their hydration. Flushing the kidneys with water will help the stones fall apart. Besides that, drinking water will also help fight UTIs. This is because flushing the kidneys and bladder helps remove unwanted bacteria. You may be wondering if bottled water is better than tap water, and what type of water you should drink for kidney health. There are a few factors to keep in mind. Tap water standards around the world vary in their safety. Tap water's purity depends on the location where you get your water. Not all drinking water at public facilities is safe. Some tap water may have high levels of manufactured chemicals or even natural minerals that are linked with health conditions such as cancer. In places where water sanitation is poor, people drink more bottled water. However, in places where tap water quality meets safety standards, tap marketing efforts may create the belief that bottled water is a better alternative. However, bottled water quality can also vary greatly, depending on its source, the material of the bottle, how the water is stored, and the substances in the water itself. In the United States, bottled water safety standards are similar to those of tap water, but this may not be true worldwide. No matter which type of water you decide to drink, drinking from a safe source is highly important. Sugary beverages may seem like a good choice when you are thirsty. However, they aren't hydrating and might even cause more harm than good. Drinks containing high amounts of sugar include sodas, smoothies, coffee, energy, and fruit drinks. Not only do they cause an unhealthy increase in blood sugar levels, but they can also increase dehydration. Beverages high in sugar trigger ADH release, which causes the kidneys to retain fluid and concentrate the urine. This puts extra stress on the kidneys to filter blood. Also, sugar from sweetened drinks can increase the production of uric acid and other byproducts. These waste products can cause inflammation and the creation of harmful substances called free radicals. Free radicals may cause damage within the tiny filtration structures of the kidneys. Sodas are also linked with causing kidney stones. Drinking large amounts of caffeine in coffee, tea, and energy drinks can cause high blood pressure, which puts additional strain on the kidneys. As an alternative, try sparkling water, black coffee, green tea, and low-sugar smoothies. Overall, drinking water is usually the best way to stay hydrated. A 2021 narrative review published in the European Journal of Nutrition states that water, without other additives, is the healthiest beverage. Next, we'll discuss tips that will help you decide when to drink water. Tip number 1. To make sure you are getting enough water throughout the day, drink water before and during meals and when you become thirsty. Tip number 2. Make sure to hydrate when you increase your physical activity. Tip number 3. Tip number 4. Make sure you note that drinking large amounts of water infrequently will only temporarily hydrate you. This amount of water may leave the body quickly to prevent blood dilution and low sodium. Instead, do the opposite. Drink small amounts of water frequently and eat hydrating foods throughout the day. Having some water in the evening will help keep you hydrated overnight. It can also decrease your body temperature to help you sleep better. However, if you have acid reflux, you might want to stop drinking water for at least 2 to 3 hours before you go to bed. Alternatively, drink only small amounts of water at bedtime to minimize the need to urinate at night. In this section, we discussed learning to recognize your signs of hydration through thirst and urine indicators, bottled water and tap water safety, and some common myths. Next, we will summarize the critical points made in the video. Be sure to watch until the end to reinforce and help you remember each point. In this video, you learned how water can damage your kidneys. Adequate water intake depends on your body composition, exertion level, overall health, and other factors. That's why daily water needs vary from person to person. You might need more than 8 cups of water a day at times, and less than 8 at other times. Advertisers claim that the drinks they market are hydrating. However, not all fluids provide adequate hydration. In fact, some contain electrolyte levels that may be too high for some people, and many contain high amounts of sugar and preservatives that may even harm kidneys over time. Next, you learned about how important water is for your kidneys. Water loss occurs through body fluids, and replacing water is vital to effectively eliminate waste, control blood pressure, and balance electrolytes. All these effects will greatly benefit your kidney health. Then, we emphasize that overhydration can reduce your blood sodium levels, harm your kidneys, and lead to serious consequences. The second half of the video discussed the importance of electrolytes and when increasing their intake is necessary for hydration. Dehydration can also damage the kidneys. Too little fluid intake may cause low blood volume and impair the kidney's filtration system. Hormones, such as renin and aldosterone, will attempt to restore the fluid balance. The resulting high pressures may weaken and damage the intricate filtering mechanism of the kidneys, leading to acute kidney injury. Drinking water regularly, and particularly when you are thirsty, may prevent dehydration and its negative impact on the kidneys. Moving on, the video then discusses how to recognize personal signs of fluid balance. Helpful indicators of fluid balance are thirst and urine color. You learned how your health may depend on whether your drinking water is safe. Lastly, knowing how much and when to drink water can influence a healthy lifestyle. Now we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Everything we've discussed in this video might be wasted if you don't watch the video on the screen. Here we share the worst 18 habits that can ruin your effort to take care of your kidneys. We also offer tips on how to stop these habits. See you there. Stay informed. Stay healthy. Online, you might find websites and YouTube channels discussing proteinuria as if it's a health condition on its own. However, it's essential to understand that proteinuria is a symptom of kidney disease characterized by an excess of protein in the urine. One may experience more frequent bathroom trips and foamy or bubbly urine. Swelling or edema, shortness of breath, fatigue, nausea, vomiting, loss of appetite, nighttime muscle cramps, and puffy eyes can also occur. Having proteinuria can be a sign of hypertension and, in severe cases, heart disease. Proteinuria may be temporary or persistent. Temporary proteinuria means there is only temporary damage to the kidney due to a sudden kidney injury, such as from a kidney infection or intense exercise and dehydration. This video will focus more on persistent proteinuria that is often due to chronic conditions and can last months or years. Addressing the root cause of proteinuria is crucial for those experiencing it. Understanding why there is an excess of protein in your urine enables you to take appropriate and safe measures to address it. Let's delve into how your kidneys function. Each kidney contains about 1 million tiny filters called nephrons. And each nephron includes a glomerulus, totaling over 1 million glomeruli per kidney. Glomeruli work like kitchen strainers, filtering waste and extra water from the blood while keeping the protein and blood cells your body needs. After the initial filtration by the glomeruli, the filtered fluid flows through the kidney tubules. These tubules reabsorb small proteins and keep them in your blood while passing waste products into urine. So, normally your urine has almost no protein. However, if glomeruli are damaged, proteins can leak into the urine. The amount of protein leaked may be too high for the tubules to reabsorb. Then, protein is excreted in the urine, or proteinuria occurs. This is problematic because proteins should remain in the blood. Reducing protein in the urine is crucial for maintaining kidney health and overall well-being. Now, let's talk about solutions. Since proteinuria isn't a specific disease, treatment should focus on its root cause, kidney disease. High blood pressure, high blood sugar levels, and high blood cholesterol are primary contributors to kidney disease. When kidney disease arises, the nephrons or glomeruli fail to retain protein within the body. High blood pressure forces blood into the kidneys with such intensity that it damages the glomeruli's walls. This pressure thickens these walls, impairing their filtering ability and causing the protein to leak into the urine. Therefore, managing high blood pressure is vital for reducing protein loss in urine. Another major cause of proteinuria is high blood sugar, or diabetes, which damages the small blood vessels in the kidneys, preventing the glomeruli from filtering blood properly. High blood sugar levels overwork the kidneys, leading to damage and protein leakage. Thus, regulating blood sugar levels is essential for managing protein loss in urine. Cholesterol levels also play a role. Excess cholesterol can cause fat buildup and blockages in arteries, narrowing blood vessels, including those supplying the kidneys. The kidneys, which receive about 20% of the heart's blood output, need proper blood flow to function effectively. Blockages from high cholesterol can disrupt this flow, leading to kidney function loss and tissue damage, manifesting as abnormal protein excretion in urine. Managing persistent proteinuria starts with lifestyle changes, such as reducing salt intake to lower blood pressure, increasing fiber intake to manage blood sugar and cholesterol, and quitting smoking and tobacco use. In essence, improving kidney function is key to stopping protein loss in urine. and we are here to provide you with essential information on this journey. From this video, you will learn how to manage proteinuria with foods that possess kidney healing properties, helping to manage or prevent high blood pressure, blood sugar, and cholesterol. 6. Red bell peppers. Bell peppers, also known as capsicum peppers, are actually a type of fruit classified as berries. Red bell peppers have the potential to reduce blood sugar levels and blood pressure, helping to alleviate or prevent proteinuria. This fruit is also rich in antioxidants and fiber, while being low in potassium, phosphorus, and sodium, making it suitable for people with kidney disease. For example, red bell peppers get their red color from anthocyanins, natural antioxidants that may protect both brain and kidney cells. Moreover, red bell peppers are packed with vitamins and minerals. Have no unhealthy fats and are low in calories, all good for your kidneys. So, eating more red bell peppers can help with proteinuria by improving kidney function. 1 cup of chopped red bell pepper has only 46 calories and provides 3 grams of fiber, supporting digestion and reducing the strain on your kidneys. Plus, this amount gives you 317% of the vitamin C and 93% of the vitamin A you need each day. These vitamins are powerful antioxidants that help fight oxidative stress in your body, including your kidneys. For instance, vitamin C can help fight cancer-causing free radicals, and vitamin A can boost the immune system. So, eating red bell peppers is an excellent way to stop proteins secreted into urine by providing you with many essential and kidney-friendly nutrients without consuming many calories. Now, if you want to eat more red bell peppers to support kidney health and stop or prevent proteinuria, choose bell peppers with vibrant colors and a glossy shine. Their skin should be smooth, and the color should be consistent all over. Look for peppers that feel firm and have a nice weight. Unlike other peppers, red bell peppers aren't spicy because they contain no capsaicin. Red bell peppers have a mildly sweet, veggie-like flavor that works well in various dishes. For pasta, you can roast red peppers and add them to cream-based sauces, low-sodium cheese or cottage cheese, which are kidney-friendly. For salads, cut them into long slivers or bite-sized chunks to add extra color, crunch, and sweetness. As a snack, you can make roasted red pepper hummus or add sliced red bell peppers to a veggie tray. In soups, try dicing, sautéing, and then adding them to elevate your soup. Also, bell peppers pair nicely with the next food on our list for a kidney-friendly diet. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 5. Quinoa. Quinoa, a pseudo-cereal native to the Andean region, is rich in protein, fiber, minerals, vitamins, and healthy fats. These all are good for your kidneys, which might in turn ease or prevent protein leakage in urine. Plus, quinoa is a gluten-free grain that provides plenty of nutrients. Its essential amino acids and polyphenol also contribute to its kidney-friendly nutrients. Quinoa also helps fight inflammation and may even help prevent cancer. When one has proteinuria, they lose protein in their urine. So they must consume high-quality protein sources like quinoa. Quinoa is a complete protein containing all 9 essential amino acids. Its balanced amino acids, high fiber content, and low levels of harmful compounds often found in grains and legumes, such as phytic acid and lectin, promote better digestion and absorption. This can further reduce the strain on your kidneys and assist in managing proteinuria. Furthermore, the compound hydrolysate in red quinoa can help with proteinuria by reducing oxidative stress and high blood pressure. In a 2023 study published in Antioxidants, which involves hypertension rats. Hydrolysate administration reduced oxidative stress and enhanced cardiovascular health, possibly stopping proteinuria. Also, rats treated with hydrolysate from red quinoa had higher antioxidant levels in their kidneys and liver than the untreated rats. Treated rats also had fewer free radicals in their blood, kidneys, and heart. Plus, quinoa can reduce excessive protein in urine by helping control blood sugar and prevent diabetes. Simply put, quinoa is a good source of magnesium, a vital mineral often lacking in diets. Higher magnesium intake may lower the risk of type 2 diabetes. You'll usually find quinoa in the grains or rice aisle of most grocery stores. It might be available in bulk bins, packaged bags, or boxes. Raw quinoa grains have a coating of saponin, a natural pest repellent that tastes really bitter. Not only can it ruin the taste of your quinoa, but it also can harm you. To avoid harm, quinoa under cold water to remove the saponin, but most strainers aren't fine enough to prevent the grains from spilling. It's much easier to buy pre-rinsed quinoa, which is clearly labeled and usually not more expensive. Quinoa can replace milk proteins and can be cooked by boiling it in water or broth until the liquid is absorbed, usually for about 15 to 20 minutes. Freezing quinoa is a great way to have it ready for quick meals. You can cook the quinoa as directed, then let it cool completely to prevent clumping when frozen. Next, place it in containers or bags and freeze. It will stay good for 2 to 3 months. While freezing keeps quinoa's kidney-friendly benefits, it might get a bit softer after thawing. This makes it perfect for casseroles, stir-fries, or soups, rather than using it as a standalone grain. Cabbage. Cabbage can help stop proteinuria by lowering your blood cholesterol. This leafy green vegetable is high in water, fiber, and antioxidants like phytosterols, which compete with bad cholesterol for absorption into the blood. This competition can lead to lower levels of blood's bad LDL cholesterol, reducing the risk of heart disease and complications affecting kidney function and causing more protein in urine. Furthermore, cabbage is packed with nutrients that can boost your immune system and promote digestive health, supporting kidney health and offering relief from proteinuria. Cabbage is also a storehouse of essential nutrients, including fiber, vitamins, such as C and K, minerals, and antioxidants. These nutrients support overall health, including kidney function. Thank you. For example, cabbage is rich in vitamin C and sulfur, which help eliminate toxins like free radicals and uric acid from the kidneys. Removing them reduces harmful toxins that can damage kidney cells and trigger proteinuria. Also, the phytonutrients found in cabbage, such as indoles and glucosinolates, are particularly effective in helping your liver detoxify and eliminate toxins, thus reducing the workload on your kidneys. Moreover, anthocyanins in cabbage have also been shown to possess anti-inflammatory properties. Chronic inflammation is linked to various health conditions, including kidney diseases. By reducing inflammation, cabbage can help protect kidney health and manage proteinuria. Cabbage also helps with blood pressure due to its iron content. Iron can help increase red blood cells, improving circulation and blood pressure. Cabbage also contains anthocyanins, powerful antioxidants that relax arteries, helping prevent plaque buildup and lower blood pressure. Note that cabbage is a potassium-rich food, which is normally beneficial for maintaining healthy blood pressure levels. Potassium helps regulate blood pressure by counteracting the effects of sodium, thus reducing the risk of hypertension and related kidney issues, such as protein overflow in urine. However, if you have certain kidney issues, you may need to limit your potassium intake. We'll explain it in more detail in the next section. Available in various colors, shapes, and sizes, cabbage offers versatility in the kitchen, whether eaten raw in salads or stir-fried for a nutritious meal. It also features prominently in fermented foods like sauerkraut and kimchi, known for their gut-friendly properties. So, instead of just boiling or steaming, consider fermenting cabbage to make sauerkraut. Fermentation not only enhances the flavor, but also increases the availability of beneficial probiotics, which can aid digestion and potentially improve gut health. A healthy gut helps eliminate toxins and waste through stool, potentially easing the burden on your kidneys. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 3. Avocados. Avocados can help with proteinuria by improving your blood cholesterol. They stand out for being low in carbohydrates and high in antioxidants and healthy fats, mainly monounsaturated fats. Plus, this creamy fruit is packed with around 20 essential vitamins and minerals. This unique profile contributes to reducing LDL, bad cholesterol, and inflammation. As we mentioned before, these effects greatly benefit your kidney health and help ease proteinuria. Eating avocados regularly can help regulate blood sugar, further stopping proteinuria. Most fruits are high in natural sugars, but avocados are not very sweet. A whole avocado has less than 1.5 grams of sugar, while a medium apple has about 19 grams. Additionally, avocado's fiber content further helps lower blood sugar and supports gut health and satiety, which can help mitigate or prevent protein in urine. Plus, avocados, like most fruits, are low in phosphorus and sodium, making them suitable for people with kidney issues, including those with proteinuria. The limited intake of these minerals helps manage kidney function and prevent further complications. However, avocados are quite high in potassium. A single serving of avocado, roughly 1/3 of the fruit, provides about 250 milligrams of potassium. But as we discussed cabbage, potassium is an essential mineral that helps control blood pressure and supports heart health. Low potassium levels can raise blood pressure and increase the risk of protein secreted in urine. In some of our other videos, we mentioned that you may need to limit your potassium intake if you have certain kidney diseases. But having kidney disease doesn't always mean you need to limit potassium. It depends on the disease stage. So, it's important to incorporate avocados into your diet with careful consideration. For those with early-stage kidney disease or kidney transplant recipients who typically do not need to restrict potassium, avocados can be safely eaten in moderation. Moreover, people on daily home dialysis, nocturnal hemodialysis, or peritoneal dialysis may need more dietary potassium. This is because dialysis helps remove a significant amount of potassium from the blood. Those on hemodialysis 3 times a week may need lower potassium levels. In such cases, working closely with a kidney dietitian is crucial to determine the safe consumption of avocados based on individual dietary needs and treatment plans. Now, if you choose avocado for your diet, note that the perfectly ripe avocado should be slightly firm but not too hard. If it's not ripe yet, but you're eager to eat it, you can speed up the ripening process by storing it in a paper bag on the counter until it softens when gently squeezed. If you need to store it for a few days, keep it in the fridge. However, don't submerge your avocado in water, which can lead to foodborne illness. Also, don't forget that eating too many avocados can cause weight gain because of their high fat content. Fats are digested slowly and make you feel full longer than other nutrients. So eating too much might lead to nutritional deficiencies. This is not good for your kidneys, and may worsen proteinuria, as your kidneys now don't get enough energy from foods to filter protein effectively. Besides avocados, avocado oil demonstrates promising potential in supporting kidney health. Avocado oil, rich in oleic acid and antioxidants, has been shown to enhance function and decrease oxidative stress within the kidney cells. Also, avocado oil intake can lower blood pressure, a significant factor in managing proteinuria. Plus, avocado oil improves vasodilation in the kidneys, which is essential for maintaining proper blood flow and preventing vascular dysfunction linked with protein in urine. Studies show that avocado oil supplementation reduced kidney damage in hypertensive rats by improving cell function and reducing oxidative stress in the kidneys. 2. Extra virgin olive oil. Extra virgin olive oil, or EVOO in short, is a type of olive oil obtained from olives using only mechanical methods, without solvents or refining. It is the highest quality and most flavorful olive oil available, characterized by its low acidity, usually below 0.8%, and superior taste and aroma. But now, how can EVOO help with stopping proteinuria? First, this popular oil is rich in monounsaturated fats, particularly oleic acid, as well as antioxidants, such as phenolic compounds, which contribute to its numerous health benefits. These benefits include reducing the risk of heart diseases, improving cholesterol levels, lowering blood pressure, and having anti-inflammatory and antioxidant properties. All these benefits help manage kidney disease and protein in the urine, as we mentioned in previous sections. Also, recently EVOO has been gaining attention due to its potential benefits in managing chronic kidney disease, or CKD. Rich in bioactive compounds like hydroxytyrosol, tyrosol, oleation, and oleocanthal, EVOO offers antioxidant and anti-inflammatory properties that may improve kidney function and reduce the risk of proteinuria. It's worth mentioning the EVOO's minor phenolic compound, 3,4-dihydroxyphenylglycol, or DHPG in short. DHPG offers antioxidant benefits, reduces harmful nitric compounds, and regulates prostacyclin production, a compound that helps prevent blood clotting and inflammation in blood vessels. These effects collectively reduce oxidative and nitrosidative stress in animal studies, improving kidney function and structure, and potentially stopping proteinuria. A 2021 study in the International Journal of Molecular Sciences analyzed 3 different diets on rats for 24 weeks. The diets included a standard diet with virgin olive oil, and a standard diet with butter plus cholesterol. Rats fed the virgin olive oil diet had similar blood pressure to those on the standard diet, while rats on the butter plus cholesterol diet had significantly higher blood pressure. Additionally, the virgin olive oil diet influenced kidney enzyme activities related to blood pressure, suggesting a beneficial effect on blood pressure regulation through improved kidney function. All these results point toward EVOO's potential in easing proteinuria. EVOO is a staple of the Mediterranean diet and is widely used in cooking, salad dressings, dipping oils, marinades, and as condiments. EVOO is high in kidney-friendly antioxidants, but low in smoke points. Thus, avoid high-heat cooking to prevent burning. EVOO is normally good for sautéed dishes and baked goods. However, we still suggest using it for low to medium heat cooking to preserve more nutrients. Also, olive oil isn't ideal for prolonged or repeated heating. When buying olive oil, choose one stored in dark glass or metal containers. These materials help shield the oil from heat and light, which can affect its quality. However, even dark glass can't fully shield your oil from oxidation, so it's a good idea to cover your olive oil bottle with aluminum foil. To ensure you get high-quality olive oil, look for ones tested for purity and quality. Look for seals from the International Olive Council, or IOC, for internationally produced oils, and the North American Olive Oil Association for North American oils. California-produced olive oils may be certified by the California Olive Oil Council. Walnuts, packed with heart-healthy fats, omega-3s, fiber, and plant protein, offer potential improvements in kidney health and support stopping proteinuria. Plus, eating walnuts can help fight inflammation, provide antioxidants, and keep you feeling full longer thanks to their high-quality protein, fat, antioxidants, and fiber content. As we mentioned before, all these nutrients can greatly improve blood pressure, blood sugar, blood cholesterol, and yes, proteinuria. Plus, walnuts are typically eaten raw, giving them stronger antioxidant properties than roasted nuts. Antioxidants help prevent or reduce kidney-damaging oxidation. With moderate levels of phosphorus and potassium and low levels of oxalates, walnuts are a smart choice for managing proteinuria and overall well-being. Plus, walnuts are high in magnesium, which is great for kidney health. A 2023 review suggested that magnesium can be used to complement the treatment of chronic kidney disease and improve kidney function. When your kidney function improves, the risk of having proteinuria in the future will be reduced. In a 2019 study published in the Diabetes and Women's Health Study, researchers investigated the link between nut intake and kidney function among women with a history of gestational diabetes mellitus, or GDM in short. They analyzed data from 607 women with a history of gestational diabetes, focusing on 330 participants free of major chronic diseases. Results showed that women consuming nuts, such as walnuts weekly, had the lowest urinary albumin to creatinine ratio, or UACR. It suggests that there is less albumin, a protein, being leaked into the urine, indicating reduced proteinuria. Daily nut consumers also exhibited higher estimated glomerular rate, or eGFR values, compared to weekly consumers. Higher eGFR is another indicator that indicates better glomerular or kidney health. And we will deal with it in another video. This suggests moderate walnut consumption may benefit proteinuria, particularly among women with prior GDM. Plus, eating just 1 ounce of walnuts every day can lower your risk of heart disease and potentially reduce your risk of kidney issues like proteinuria. However, eating more than a handful or 2 of walnuts daily can add extra calories, potentially causing weight gain. So, it's important to be mindful of your portion size and avoid walnuts with added salt, sugar, or chocolate. They contain more sugars and calories that can put more strain on your kidneys. To keep walnuts tasting fresh, store them in a cool place. Warm temperatures can make walnuts go bad, causing them to smell and taste off. If they smell like paint thinner, they're rancid and should be thrown away. Rancid walnuts aren't good for your kidneys or overall health. So, when you bring walnuts home, it's best to store them in your fridge or freezer. Also, wait to chop or shell them until you're ready to use. This keeps the flavor fresh and prevents your walnuts from turning rancid. Still, note that while cold temperatures slow down spoilage, it's best to buy nuts in smaller amounts that we can eat quickly. Other causes of high protein in urine. Note that having a lot of protein in your urine doesn't always signal a kidney issue needing treatment. If you are doing too intense exercise or dehydrating, or if you are experiencing stress, pregnancy, or a poor diet, your urine protein levels can temporarily rise. So, it's important to check your diet, habits, and health conditions to understand why your urine protein levels might be high. Also, pregnant individuals with a history of preeclampsia should have regular checkups. Preeclampsia is a condition with high blood pressure and liver and kidney damage. It usually resolves after childbirth. However, monitoring is still essential. Your doctor might suggest further urine tests to monitor protein levels over time. If they stay high, it could indicate a real kidney disease. During healthcare visits, try to ask specific questions about the diagnosis, treatment plan, lifestyle adjustments, and potential alternative conditions. Also, working with a registered dietitian can help protect your kidneys and reduce proteinuria. They can assist you in planning meals to help you lose weight if needed, avoid high-sodium foods, and eat the right amounts and types of protein. To wrap it up, proteinuria, or having too much protein in your urine, can be a sign of kidney damage. The top 6 superfoods discussed: red bell peppers, quinoa, cabbage, avocados, extra virgin olive oil, and walnuts, offer promising avenues for managing proteinuria and supporting kidney health. Understanding the causes, symptoms, and proactive steps for prevention and management is crucial. Causes of proteinuria range from dehydration and excessive exercise to underlying kidney issues and conditions like diabetes. It's important to maintain a balanced diet, stay hydrated, manage underlying health conditions, and seek medical attention for persistent symptoms to actively prevent proteinuria. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Everything we've discussed in this video might be wasted if you don't watch the video on the screen. Here, we share the worst 22 foods that can ruin your effort to heal proteinuria and kidney disease. We also offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed. Stay healthy. 9 skin signs that may indicate your kidneys are damaged. It is important to know that skin changes usually appear when you've already been having problems with your kidneys for a while. Remember, early detection and treatment can make a world of difference in kidney health. According to the latest studies, more than 800 million people worldwide may experience chronic kidney disease. So, if you have any risk factors, such as high blood pressure, diabetes, or obesity, or if you suspect kidney problems, check for these skin signs and discover helpful tips for keeping your skin healthy. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Skin signs of kidney disease: some skin changes are specific to kidney disease, whereas other changes in the skin are non-specific and may be associated with a variety of medical problems. 1. Itchy skin or pruritus. This is one of the most common skin symptoms in people with kidney damage, occurring in as many as 40% of people with end-stage renal disease, or ESRD for short. But what causes this itchiness? When the kidneys cannot effectively filter out waste products, urea accumulates in the blood. This buildup can lead to uremic pruritus, the medical term for itching caused by kidney disease. Itchy skin can occur anywhere on the body, but it commonly affects the back, legs, and arms. It is intensified by sweat, dry skin, and heat. While it may sound mild, this itchiness can be so intense and persistent that it can lead to a poor quality of life. When the pruritus is severe, the urgent need to scratch leads to more severe skin problems. Scratching may cause scrapes, or excoriations, on the skin, thicken, leathery skin, or skin lichenification, or raised bumps, or prurigo nodularis. Ongoing scratching can cause lesions to bleed, and a compromised skin barrier becomes an easy way for bacteria to enter and lead to more severe infections. Are you enjoying our video so far? If so, please give us some hints by dropping a like and we'll make more content like this. 2. Rashes. Rashes are also a common skin sign in people with kidney damage caused by poor elimination of toxins that build up in the skin. Acquired perforating dermatosis is a type of rash that appears in individuals with end-stage kidney damage. In the form of small, pigmented, itchy bumps with a scaling center. These bumps can usually be found on arms and legs. Less commonly, they may be found on the trunk, scalp, and buttocks. As the bumps heal, new ones can appear, creating lesions in multiple stages of healing, which may join together to form larger patches. Although these rashes are often itchy, you should avoid scratching because it can lead to worsened skin conditions. 3. Blisters. Blisters may also occur in people with kidney damage. They often appear as fluid-filled sacs on exposed areas, such as the backs of the hands, forearms, or, less often, on the feet and the face. Kidney damage is just one potential cause of blisters. Blisters can be caused by infections, medications, poor diet, and heavy alcohol intake. Blisters associated with kidney damage can vary in size and severity. They may be accompanied by other symptoms such as pain, redness, and swelling. Unfortunately, when blisters heal, they dry up and develop a crust that later peels away, usually leaving a scar and skin discoloration. 4. Calcium deposits. Calciphylaxis is one of the most severe skin conditions associated with kidney damage. It occurs when calcium accumulates in small blood vessels, leading to painful sores and ulcers. It's a rare but serious condition that occurs in up to 4% of patients undergoing dialysis and requires immediate medical attention. The exact cause of calciphylaxis remains unclear, but several factors can increase the risk. High blood calcium levels. This often happens due to imbalances in calcium and phosphate. 2. Dialysis. Long-term dialysis patients are more at risk. 3. Obesity. Higher body mass index, or BMI, can be a contributing factor. 4. Medications. Certain medications can impact calcium metabolism. Patients with calciphylaxis describe painful pink or purple bumps or plaques that develop into deep, painful ulcers covered with black crusts, usually located on the abdomen, buttocks, and legs. Another type of calcium accumulation is represented by calcinosis cutis, which refers to calcium deposits under the skin. Calcium. These are usually firm white nodules near joints that may break through the skin and release a white chalky discharge. Calcinosis cutis are usually not painful unless they are located in the fingers or toes. 5. Dry skin xerosis. Dry skin or xerosis is one of the most common skin signs of kidney damage. However, dry skin is nonspecific as it can be caused by a number of conditions besides kidney damage. Dry skin occurs in 50–80% of individuals on dialysis. And here are a few common causes. 1. Poor hydration. Decreased sweat gland activity. 3. High levels of vitamin A. And 4. Long-term use of diuretics. Xerosis usually occurs in those who have been dealing with kidney damage for a while and are on dialysis, which often causes skin to become dry, rough, and scaly. People with xerosis also experience tight skin that can easily crack, leading to exposed entryways for bacteria. For those interested in the evidence, The studies supporting our claims are provided in the link in our description box. 6. Swelling. The kidneys have many functions. One of the most important ones being the elimination of excess water and salt from our bodies. If your kidneys are damaged, water and salt may not be eliminated properly, leading to a buildup of fluid. This water and salt retention causes swelling and puffiness, especially in the hands, feet, and face. 6. Swelling. If your legs feel puffier than usual, press them with your finger to see if it leaves an indentation, called pitting edema. If you experience swelling and puffiness, you should see your healthcare provider to have your kidney function evaluated. 7. Changes in skin color. The presence of kidney damage can lead to a buildup of waste products in your bloodstream, which may cause your skin to change color, often with gray or yellow hue. This discoloration results from the toxins that are not being filtered and excreted in the urine. Skin hyperpigmentation may also occur as a result of a buildup of melanin, and it may be seen as a dark brown color. Skin pallor, or paleness, is commonly observed in individuals with chronic kidney disease caused by anemia. Another skin discoloration related to kidney damage is uremic frost, a white, powdery substance left on the skin's surface after sweat dries. Excessive scratching may also change the color or texture of your skin. 8. Nail disorders. Many medical conditions can cause nail changes, including kidney disorders. In a study of 100 patients, nail changes were found in 60% of individuals with CKD. In another study of 101 patients with severe renal disease who were on dialysis, 8. Nail disorders. Hair, mucosal, and nail disorders were found in 23–45% of the patients. On your finger or toenails, you may notice one white transverse band, called Mees line, or multiple bands, called Morch's lines. These can appear in people with kidney damage due to stress or low protein levels in their blood. Another frequent finding is the half and half nail disorder, also known as Lindsay nails, characterized by a brownish color at the top of the nails from increased melanin and a white or pink color at the bottom of the nails due to an increased number of small blood vessels. Less common changes are splinter hemorrhages, which are small, red or brown lines under the nails that resemble splinters. They can be a sign of underlying health issues including kidney damage, and they are caused by small blood clots that damage the capillaries under the nails. Keeping nails trimmed and moisturized can reduce the risk of nail disorders. 9. Hair disorders. One of the most troubling symptoms for individuals with kidney damage is hair loss. This condition, medically known as alopecia, can have an impact on self-esteem and quality of life. Hair loss can result from several factors associated with kidney disease. 1. Nutritional deficiencies. Kidney damage often leads to imbalances in essential vitamins and minerals, such as iron and zinc, which are critical for healthy hair growth. 2. Hormonal imbalances. The kidneys regulate many different hormones that affect hair growth. When the kidneys are not working properly, it can lead to hormone dysregulations, which can affect hair growth cycles. 3. Medications. Some of the medications prescribed for kidney disease, including certain blood pressure medications and immunosuppressants, can contribute to hair thinning and loss. Dehydration and dialysis treatment can strip hair of natural oils, making it more dry and brittle. It is important to remember that hair loss and hair shedding can occur from a variety of medical conditions. If you are experiencing a sudden increase in hair shedding or patches of alopecia, see your healthcare professional to help determine the cause. What can you do? We covered many skin signs, some more severe that would make us call our doctor, and other more common ones that may not necessarily be related to kidney damage. So, the question that follows is, when to seek medical help, and who to consult for these symptoms. As this video shows, some skin symptoms are more specific or serious, and clearly require a visit to a healthcare provider. But what do we do about those less alarming symptoms that we might ignore or confuse with other causes? Kidney damage affects many people, but there are some risk factors for kidney disease that you should consider when you notice skin changes. If you are over 60 with other conditions such as high blood pressure, diabetes, or obesity, pay close attention to your skin and nail changes, even seemingly ordinary ones. You should contact your primary care doctor at any sign of skin changes. For more information, visit www.fema.gov. Blood and urine tests will help diagnose kidney problems, allowing you to start proper treatment recommended by a nephrologist or kidney doctor. You must communicate well with your doctor, who can explain your condition and how to prevent further skin changes. If you have severe or persistent skin symptoms, you should see a dermatologist or skin doctor who can collaborate with your nephrologist. How can I manage these symptoms by myself? After being diagnosed, you should initiate proper treatment, but you should not rely only on medication. Our lifestyle and day-to-day practices play a key role in the healing process. You need to make important changes to manage kidney damage. These changes include diet and nutrition. Eating a balanced, kidney-friendly diet is important for your skin health. Monitor your salt, protein, phosphate, and calcium intake. Quit smoking and limit or avoid alcohol consumption. Search for new recipes or talk to a nutritionist who can recommend dishes based on your favorite flavors. 2. Hydration. Drinking enough water can help keep your skin hydrated and reduce dryness. However, if you have kidney issues, especially if you are on dialysis, overhydration can lead to fluid buildup. To manage thirst when restricting fluids, eat pieces of frozen fruit, drink small sips, or rinse your mouth with mouthwash. Consult your healthcare provider to determine your ideal water intake. 3. Moisturizing. To combat dryness and itchiness, moisturize your skin at least once a day. Use fragrance-free hypoallergenic moisturizers to avoid irritation. Emollients that contain salicylic acid or urea and a gentle skincare regimen can be useful. 4. Avoiding hot showers and baths. Hot showers can strip your skin of its natural oils, making it dry and itchy. Avoid long baths and try taking short showers with lukewarm water. 5. Avoiding harsh skincare products. Avoid using harsh soaps and skincare products that can irritate your skin. Stick to gentle, fragrance-free products designed for sensitive skin. 6. Sun protection. Sun damage can worsen skin problems, especially if your skin is sensitive. Use sunscreen with at least SPF 30 to protect your skin, even on cloudy days, and reapply it throughout the day. 7. Comfortable clothing. Wear loose-fitting, comfortable clothing made from natural fibers like cotton. This can help prevent irritation and allow your skin to breathe. 8. Regular checkups. Regular checkups are essential for monitoring your kidney function and overall health. Discuss any new symptoms or concerns with your doctor during these visits. What is the most important takeaway from this video? When it comes to kidney health, recognizing skin signs is crucial for early diagnosis and effective management. Kidney damage often causes specific symptoms like itchy skin, rashes, blisters, and calcium buildup in vessels and skin. It can also lead to nonspecific signs such as dry skin, swelling, changes in skin color, nail and hair disorders. Each of these symptoms signals potential underlying renal problems. For more information, visit www.fema.gov. Itchy skin, for example, affects 90% of people on hemodialysis due to the buildup of waste products like urea. Similarly, rashes, blisters, and calcium deposits signal that the kidneys struggle to eliminate toxins effectively. Although less specific, nail and hair disorders should not be ignored, especially in those with associated risk factors, as they can signal deteriorating kidney function. People with kidney disease should watch for these symptoms, especially if they are at high risk, due to factors like age over 60, diabetes, high blood pressure, or obesity. Early detection can significantly improve treatment outcomes. Seek immediate medical help when these signs appear. Blood and urine tests will confirm the diagnosis and pave the way for proper treatment, often involving collaboration between a nephrologist and dermatologist. Managing these symptoms involves more than just medical treatment. Lifestyle changes play a crucial role. These include maintaining a balanced diet, staying hydrated without excess, using gentle skincare products, avoiding hot showers and harsh soaps, and ensuring proper sun protection. Such changes can greatly improve your quality of life and skin health. In conclusion, recognizing and addressing skin signs linked to kidney damage on time helps diagnosis and management of the condition. Adopting a proactive approach helps manage the symptoms and improves overall kidney health and quality of life. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Have you seen any signs from our video or worried about kidney disease? Your kidneys might need a natural boost. Check out the video on the screen for the top 5 fruits that can help cleanse your kidneys. We also offer tips to get the most from them. See you there. Stay informed. Stay healthy. Why am I urinating every 2 hours? Possible causes. Before we get into the causes, it's good to know that needing to pee every 2 hours can be normal for some people. As you get older, you will need to urinate more often, and it's normal to wake up occasionally during the night to urinate. For instance, in your 40s and 50s, waking up once a night to go to the bathroom is typical. In your 60s and 70s, it might be twice a night, and in your 80s and beyond, it could be 2 to 3 times. However, waking up too often at night to urinate, also known as nocturia, can disrupt your sleep and may indicate a health issue, such as heart disease, sleep disorder, and swelling. Sometimes, the increased urination frequency comes with kidney pain. By kidney pain, we mean that dull ache in your back, stomach area, or lateral sides. Kidney pain results from various diseases. Most of these diseases also result in frequent urination, or feeling the urge to urinate every 2 hours. But if you experience pain along with frequent urination, it may not always be kidney-related. Pain at the start or during urination points to a urethral issue, while pain after urination suggests problems in the bladder or prostate. These issues can be associated with kidney pain due to the close proximity of the bladder, prostate, and urethra to the kidneys. Whether you feel the pain or not, there are multiple reasons for frequent urination. These can be due to kidney or bladder problems or non-renal diseases. Now, let's see the possible causes of frequent urination. 1. Urinary tract infections, or UTIs in short. The urinary tract is the pathway from the kidneys to the urethra that moves urine from the inside to the outside of the body. It starts in the kidneys, where urine is formed, and then passes through the ureters to the bladder, where it's stored. Finally, urine is expelled from the body through the urethra. Infection of any part of the urinary tract is one of the most common reasons for frequent urination and is associated with pain. It can be kidney infection, also known as pyelonephritis, bladder infection, also known as cystitis, and urethra infection, also known as urethritis. To give you an idea, infection leads to inflammation, which can irritate the lining of the urinary tract, leading to a greater urge to urinate. Also, to flush out the bacteria causing the infection, your body may increase urine production. Other than frequent urination, other symptoms of UTIs are pain in the groin or lower abdomen, bloody or cloudy urine, pain while passing urine, also known as dysuria, nausea, fever, or chills. Are you enjoying our videos so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 2. Kidney diseases. If you think that you need to urinate more often, especially at night, also known as nocturia, this may indicate there's a problem with how your kidneys are filtering urine. More specifically, it can be related to an issue with the kidney's filtration system, and you may have a kidney disorder. Your kidneys are like the body's natural filters, helping to remove waste and excess fluids by creating urine. Normally, your kidneys do a great job of concentrating urine by reabsorbing water back into the bloodstream. However, if the kidneys get damaged, their ability to concentrate urine diminishes. This means they can't reabsorb water as effectively, leading to the production of larger volumes of dilute urine. This increased volume means that one needs to urinate more frequently. 3. Bladder issues. 3. Bladder issues. When you urinate frequently, it can sometimes be due to problems with the bladder. One common issue is the presence of stones in the bladder. These stones can cause several symptoms, including difficulty urinating, pain during urination, and lower abdominal pain. These symptoms can make it hard to fully empty your bladder, leading to a frequent urge to use the bathroom to pass urine. Another concerning issue is bladder pain syndrome, also known as interstitial cystitis. This is a chronic condition where people experience ongoing pain in the lower abdomen for weeks. This pain is often accompanied by a frequent need to urinate. The exact cause of this condition is not fully understood, but it may involve a defect in the immune system, similar to autoimmune disorders or allergic reactions. Sometimes, frequent urination can signify a more severe issue, such as bladder cancer. This cancer can also present with lower abdominal or back pain and blood in the urine. 4. Urethral stricture. The urethra is the last part of the urinary tract that is responsible for draining urine out of the body. Sometimes it can become narrow due to injuries or infections, and this condition is known as urethral stricture. This narrowing can lead to difficulty when urinating, often causing the need to run to urinate again and again because you cannot completely pass all the urine out in one go. The next reasons on our list might not be directly related to a urinary tract condition, but they can still be common and worrisome. 5. Prostate problems. Another common reason for needing to urinate more often is benign prostatic hyperplasia, or BPH in short, which affects the prostate gland in males. The gland, located just below the bladder, plays a role in producing semen, also known as male fluid containing sperm. As men age, it's common for this gland to get enlarged, producing urinary symptoms. The most common symptom of BPH is an increase in the frequency of urination and difficulty controlling or retaining urine. Simply put, an enlarged prostate can obstruct the flow of urine from the bladder, causing incomplete emptying, just like the case of urethral stricture, and consequently, frequent urination. Additionally, a prostate infection, also known as prostatitis, can cause you to feel the need to urinate frequently. This condition can also make urination painful. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 6. Vaginal issues. We've discussed how infections in the urinary tract or prostate can lead to more frequent trips to the bathroom. Similarly, vaginal infections, also known as vaginitis, whether from bacteria or yeast, can also increase the need to urinate. Another possible cause is anterior vaginal prolapse, also known as sister seal. It is a condition where the bladder drops from its normal position and pushes against the front wall of the vagina. This happens because the pelvic floor muscles, which support the bladder and other pelvic organs, become weakened or stretched. Because the bladder is displaced and not fully supported, it can cause a sensation of needing to urinate more often. But why do sister seals occur? The common reasons for pelvic floor weakness and bladder displacement are chronic constipation, multiple childbirth, or heavy weightlifting. Besides causing recurrent urination, sister seals can also lead to pressure symptoms in the pelvis. 7. Pregnancy. As the baby grows during pregnancy, the uterus expands to accommodate the developing fetus. 7. Pregnancy. The bladder, which sits below the uterus, gets pressed upon by the growing uterus, which takes up more space. This pressure reduces the bladder's capacity to hold urine, resulting in an increased frequency of urination. 8. Neurological disorders. Our nervous system contains a network of nerves that regulate bladder function. These nerves normally communicate between the bladder and the spinal cord and brain, instructing the bladder muscles to contract or relax in order to store or release urine. However, conditions like neurological disorders, stroke, and spinal cord injuries disrupt these nerves. This disruption often results in frequent urination and loss of control in holding urine. 9. Diabetes. 9. Diabetes. Diabetes is a chronic condition where there is an excess of glucose in the bloodstream. We may all know that the kidneys play a crucial role in filtering blood. So, when there's excess glucose in the blood, the kidneys need to work harder to filter it out and excrete it through urine. That's why people with type 1 and type 2 diabetes urinate more frequently. Also, diabetes is a major cause of kidney damage. High blood sugar from diabetes can damage the kidney's small blood vessels, making it hard for the kidneys to filter properly. As we discussed earlier, kidney damage is a common cause of increasing the urge to urinate. 10. Medications. Some medicines involve increasing the urine output. Diuretics, which help with conditions like fluid retention or swelling, is an expelling example. These drugs help the kidneys remove excess water and salt from the body through urine, increasing the frequency of urination. Remember, some common medications can impact kidney health, such as NSAIDs for inflammation, antibiotics for infections, or PPIs for acid reflux. We can't cover all of them in this video, but you'll find a detailed explanation in the video on the screen. We also shared tips for using them safely. 11. Your drinks. Sometimes, after a tough workout, sauna session, or a hot day out, you might find yourself drinking more than usual. If you end up needing to urinate more often during those times, don't worry. Your body and kidneys are doing their job well. Increased urination in this case simply means more fluid and equals more fluid out. Also, note that drinking alcohol and caffeine also increases the frequency of urination. However, there is no exact limit yet at which urinary frequency gets disturbed by these drinks. When to see your doctor. Earlier in the video, we mentioned that not every instance of frequent urination is cause for concern. However, there are some signs you should pay attention to. If frequent urination is accompanied by high fever and chills, seek medical help. It could indicate an infection. Also, don't ignore symptoms like one-sided pain, lower abdominal or back pain, painful urination, also known as dysuria, or blood in your urine, or hematuria, alongside frequent trips to the bathroom. And if you notice a vaginal or penile discharge, especially if it resembles pus, it is a clear sign to see your doctor. Some people may ask if seeing urine color would help to diagnose kidney disease. The answer is no, as damaged kidneys do not change the color of urine most of the time. However, when kidneys fail, urine could appear frothy or foamy due to the presence of protein. Foamy urine is also an early symptom of kidney disease, so be mindful of that. Other than this, there is no specific variation in the color of urine when the kidneys fail. If you can't pinpoint why you're urinating more often lately, like changes in how much you drink or drinks like alcohol or caffeine, it's also a good idea to talk to your doctor. This is especially important if it's affecting your sleep. During your visit, your doctor will ask about your fluid intake, medications you are taking, your drinking habits, if there is any swelling in your feet, for how long you have been experiencing this. And if you've experienced associated symptoms such as burning or pain when urinating, they might also ask about your history of fevers and whether you snore. It's good to think about these details before your appointment to help your doctor better understand your situation. Possible treatments for frequent urination. Once your doctor diagnoses your condition, they'll discuss possible treatment options with you. Just like with any symptom, the treatment for frequent urination will depend on what's causing it. For instance, urinary tract infections, or UTIs in short, are typically treated with antibiotics. And as the infection clears up, your urination frequency should return to normal. However, antibiotics can affect your kidneys, so it's wise to discuss your dosage with your doctor, and focus on eating more kidney-friendly foods, which we will mention later in this video. If bladder pain syndrome is the cause for your increased trip to the bathroom, opt for healthy lifestyle changes such as stress reduction, dietary changes, exercises, and bladder retraining techniques. Note that bladder cancer and urethral stricture require expert opinion to provide you relief and may involve surgical intervention in most cases. Now, benign prostatic hyperplasia, or BPH in short, can be treated with medications that ease obstruction. And refractory cases require surgical excision of enlarged prostatic tissue. If diabetes is the cause, it's important to properly manage your glucose intake. For anterior vaginal prolapse, Kegel exercises or pelvic floor exercises can be helpful. Also, frequent urination during pregnancy can be managed with pelvic floor exercises, high fiber intake, and limiting fluid after dinner. And before opting for any treatment, don't forget that fluid modification and tracking what kind of drinks you consume daily also help devise ways to reduce frequent urination. Home remedies for frequent urination. When it comes to home remedies, there's not much you can do to reduce frequent urination, except if it's due to your drinking habit. You can keep a diary to monitor the exact frequency of urination. This will also help find the cause. It's important to consult your doctor. But you can use some home remedies to support your treatment if you have any of the conditions we mentioned earlier. The best thing you can do is to cut down on caffeinated drinks, alcohol, and sodas. Also, try not to drink water a few hours before bedtime to avoid those late-night trips to the bathroom. Also, you can try bladder retraining techniques. These involve gradually trying to hold urine for increasing intervals, which will help build bladder capacity. Another suggested exercise is the pelvic floor exercises, which are particularly important for elderly women. It will strengthen the muscles of the bladder and its holding capacity, like the bladder retraining techniques. In case of frequent urination owing to UTIs, some simple home remedies to get rid of them are increased garlic intake, cranberry juice, and probiotics. Though more research is needed in this domain. Also, avoid citrus and acidic foods, which may irritate your bladder if you have an infection. How to prevent kidney diseases. Preventing kidney disease mostly comes down to making healthy lifestyle choices. It's important to keep yourself physically active, so try to do at least 30 minutes of exercise per day. If you are obese or overweight, aim to reduce weight to save yourself from a lot of diseases, including kidney diseases. Also, if you drink or smoke, try to cut back, and if you don't, it's best not to start. You should not drink more than 1 drink of alcohol per day if you are female and more than 2 drinks a day if you are a male. Try to seek help if you are having a hard time quitting smoking. One more important thing to prevent kidney disease is managing your other conditions. For example, hypertension, 120/80 millimeters of mercury, is one of the most common reasons for kidney damage. Get your blood pressure checked regularly and seek medical attention if found above the normal range. If it is in the normal range, some lifestyle tips can prevent it from getting higher, such as reducing salt intake, exercising, and dietary changes. Plus, managing your blood sugar levels is also important, as diabetes affects the kidneys a lot. Complying with your diabetes medicines, lifestyle modification, and regularly monitoring your blood sugar can save you from kidney diseases. It's best to avoid excessive use of over-the-counter painkillers or OTC analgesics. Painkillers, such as NSAIDs, can damage the blood vessels of the kidneys, so use them cautiously and ask your doctor about the quantity that is allowed for your disease or pain. Healthy food that protects your heart and kidneys include fresh fruits and vegetables, whole grains, fat-free dairy products. Try to 10% of your daily calories and limit sodium, which is abundant in salt, to less than 2.3 grams per day. You can use spices to replace salt, to add taste to your food, and try to bake or broil your meat instead of frying it. Water is the best drink for your kidneys. Water has 0 calories and is best for hydration and normal functioning of the body as well. To quench your thirst, try to prefer water over anything else, particularly when you're at risk of having a kidney disease. In this video, you learned frequent urination can be due to renal or non-renal diseases. Important causes of increased frequency of urination are urinary tract infections, or UTIs, benign prostatic hyperplasia, or BPH, bladder stones, urethral stricture, bladder cancer, diabetes, pregnancy, vaginal prolapse, and increased water intake. It is important to consult your doctor if you notice frequent urination with blood in urine, lower abdominal pain, fever, chills, or vomiting. Possible treatment of frequent urination depends upon its cause, such as antibiotics for UTIs and surgical intervention for cancer and urethral strictures. Home remedies for frequent urination include fluid modification, bladder retraining techniques, pelvic floor exercises, and the avoidance of citrus foods. Dietary changes, exercises, controlling blood pressure and sugar levels, and avoiding painkillers can all help prevent kidney disease. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. If you are suffering from kidney disease, You need to modify your diet, which helps fight the damage present there. These include strawberries, red bell peppers, low-phosphorus cheese, pomegranates, blueberries, avocados, tofu, fish, root vegetables, broccoli, beans, etc. For more details, you can watch the video on the screen. Here, we share the top 6 superfoods to heal kidney disease. We also offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed, stay healthy.